Hi, so today we're going to be doing the IV bolus medication. So the first thing I'm going to do, I'm going to come to my patient's room. I'm going to make sure I have a doctor's order, which I do right here, and it's to give 4 milligrams of morphine. Our morphine comes 2 milligrams per ml, which I've already drawn up, so it ends up that we're having 2 milligrams, which equals, or 2 mils, 4 milligrams. So I'm going to come to my patient's room, have my patient identify themselves, check name and date of birth. I'm going to make sure that I already did my med sheet, so I know all of the side effects, the onset and stuff of morphine. I know that it can depress the respiratory system, so I'm going to make sure I monitor my patient's respiratory rate and vitals. I'm going to get a set of vitals before I give the medication. I'm going to go wash my hands, come back, put on some gloves. So at this time, I'm going to make sure that my patient's also not at risk for fluid overload. They are not. I'm going to ask my patient for the allergies, make sure that he definitely doesn't have an allergy to morphine, and then I'm going to do my 7 rights: right patient, right medication, right route, right time, right dose, right reason, and right documentation. So this is labeled that I have 2 milligrams, it's kind of hard to see, or 2 mils, there's 4 milligrams of morphine in here, and I have my syringe that I'm going to be injecting it into. So first thing I do before I do any of that, I'm going to make sure that this IV is patent. I'm going to check it for any signs of redness, infiltration, if there is any swelling, tenderness at the site. So I'm also going to answer any questions my patient has. If they, I'm going to let them know, exactly what morphine does. And I checked it along with the vitals. I got a pain rating. Their pain's at a 9, and so obviously the reason for this medication is we're going to try to get that pain a little bit lower and answer any questions that they have. So I'm going to untape this little side piece right here. There you go. And I'm going to give it to the port, give it in the port closest to the patient. So I'm going to occlude the port above, and then I'm going to clean this site with alcohol. Want it nice and clean. So then I have just my saline flush. I'm going to make sure I expel all the air out of it. Okay, I'm going to pull back a little bit, make sure that my IV is patent, and I get good blood return. Flush just a little bit. Perfect. Saline flying everywhere. Okay, it flushed great, so no sign or any problems with that. I'm going to set this back down. Okay, so like I said, I'm now going to insert my morphine into my syringe. Okay, so there's 8 mLs in there. When I'm done, it will have 10 mLs total with 4 milligrams of morphine in 10 mLs. But put the safety on my needle. And then I'm going to transfer my needle to my morphine. If I were to set this down, walk away from it, or do anything with it, I would want to make sure I label it. I'm going to label it anyway. This says exactly how much more medication's in here. 2 milligrams, or 4 milligrams of morphine, 8 mils of saline. So then, since I set my port down and it may have got some germs flying on it, I'm going to reclean it. Okay, and then here comes the lovely part. I'm going to give this medication over 4 minutes. Prepare yourself for the next 4 minutes of your life, right? Okay, so like I said, the port above it is occluded. I already had expelled make sure I expel all the air out of that before I can get it right there. Yep, there's a big old bubble. There's still air in here, so I'm going to make sure I expel it all out because I don't want to be injecting air into my patient. Okay. I'm going to touch that. And then make sure that I can see the mils because I'm going to give this over 4 minutes. And here we go. while I'm giving this medication, I want to make sure that the patient doesn't experience any adverse side effects. I know nausea is one of them. Just make sure that they feel okay. I let the patient know to let me know if they have any weird feeling, dizziness or anything like that, and I can slow it down as well. Down. Minutes down. This is so painful. 2.5 minutes down. Three minutes down. 60 more seconds of your life. Three and a half minutes down. About 1 ml left to give. All right. Just put that in there. Perfect. And 4 minutes down. Okay, so I'm going to go ahead and take this off. So this tubing still has morphine in it, so I'm going to make sure when I flush it, my saline flush, make sure there's no air in this, that I push this next mill over another 60 seconds of your life. And then after that minute is up, right now, I can go ahead and flush it with a couple more cc's. The IV still looking, the IV side's still looking great. I don't see any redness or any inflammation like that, so I have no reason to believe that there's an uveitis or infiltration. I'm going to secure that back down. I'm going to unlock the port, or per protocol, depending if it's locked or whatever. And then I'm going to make sure I throw my needle in the sharps container, and I'm going to continue to monitor my patient over the next 10 minutes. I'm then going to come in within 30 minutes and reassess them. I'm going to get another set of vitals, another pain reading, and make sure that this morphine is doing its job. And that is everything. Have a good day.